Hi, everyone. It's Julie from Reset Medical and Wellness. For those that don't know who I am, I retired from the Chicago Police Department 2 years ago and I did 25 years of service. So, one of the great things at working at Reset Medical has been the stories that I hear from all the patients who have gotten the treatment done and it has changed their lives. Now, as you know, working as a first responder, you don't go through that unscathed. It doesn't matter if you work in the middle of Ohio or you work in Chicago. At some point in your career, you're going to go to that call that's going to make a drastic difference in your life. So, on top of that, for those that don't know me, I also raised a son who suffered from mental health issues, serious mental health issues, which has kind of left my body and my nervous system very disrupted. So I wanted to bring you on this journey with me because I think it's important that people see it firsthand, see what it looks like, and so that it can kind of take away the scary part of it. My hope is during this journey that it will calm my nervous system and I will be in a better place to handle stressors and life in general. Let's be honest. Some of the things that we go through can be the hypervigilance, it can be the fight or flight consistently, anxiety. Many people that I work with struggled with alcohol and other addictions. And it takes a toll on us medically speaking, high blood pressure, insulin resistance, diabetes, insomnia. So, my hope is by going through this journey and you being able to watch it, that you too will want to come and get your nervous system reset. I work here because I believe in this process and it works. I've seen it work. I've seen it change lives. I've seen it save lives. And so I appreciate you taking this journey with me and feel free to share it with anyone you know. I feel like for me, it definitely brought a calm over me. I was a little bit tired, doing a lot of yawning, um, but nothing too crazy where I couldn't function or walk or anything like that. So I would say I woke up today feeling great. I am looking forward to the next side being done. And overall, I feel like my mood has been elevated. So I'm super excited about that. Anyway, I just wanted to report back and let everybody know kind of what it looks like, what happens, what you're experiencing. Everyone experiences it a little differently. But for me, I'm super hopeful for the second set of shots.
So we are doing a left side cervical sympathetic block, otherwise known as a stellate ganglion block or neurosympathetic reset. What I'm doing right now is just taking a look with the ultrasound. So we'll look for a few minutes and map out the anatomy, identify the nerve in question that we need to target, as well as the surrounding structures, mark it, make some measurements so that we can accurately and safely place the medicine around that sympathetic nerve.
So what are you looking at right now?
So right now, I'm going to pause this. So right now, what we can see is we can see the carotid artery, the jugular vein, and then right down here, this white spot is in fact the nerve bundle that we'll be targeting. And I'll look at it at a couple different angles. Here's the bundle again.
Does it hurt?
It does not. You're going to feel some pressure, and I'm going to numb the area first. So we'll numb the surface, give that a couple minutes, and then once it's numb, you'll feel some pressure as we do the injection. But the injection itself only takes about a minute, very quick. Turn a little bit more to your right, Julie. Perfect. Okay, just going to clean the area.
Are there any side effects?
So there's no lasting side effects, but of course, when we're putting a bunch of anesthetic into this area, it's going to affect the surrounding tissues and the nerve that we're targeting. And so there'll be numbing effects in this area, there'll be warmth, congestion, a droopy eye, sometimes numbness in the vocal cord, which can make you hoarse for a couple hours. But all these effects are very temporary and expected. And in fact, they tell us that we had a good block when we see some of them because we know that nerve is turned off. And so we like to see those effects. I'm going to get the area sterile and drape it here to keep this area clean. So the first thing we're going to do is just numb the surface with a little pinch of lidocaine, a little pinch and a sting, 1, 2, 3 pinch, and a little sting. Good job. So you asked earlier who a candidate is for this type of treatment. It's a great question. So patients that have symptoms of sympathetic overactivation. Now what that means is symptoms like restlessness, insomnia, hypervigilance, panic attacks, chronic anxiety. These are symptoms that are occurring because your sympathetic nervous system is over responsive to its environment. It's telling you that there's a constant threat even when there is none. And by lowering that activation through this treatment, you can integrate other more helpful treatments like therapy and mindfulness practices more effectively. And that's what makes this such a breakthrough treatment. We'll give that a couple minutes, okay? To do the treatment, I'm going to hand Shauna, the nurse, the actual medicine. She holds that with the syringe so I can guide the needle and do the injection with the ultrasound at the same time.
What is the actual medicine that you use?
So we use an anesthetic called ropivacaine, which is a very long-acting anesthetic. A lot of people question whether that's the best anesthetic, and so there's studies that look at different ones like lidocaine or novocaine or bupivacaine or ropivacaine, and the reality is they're all very similar, but ropivacaine is objectively the safest because it has the least effects negatively on the heart.
How long do the results last for people?
So results vary, but a study came out earlier this year that was showing that patients were having lasting benefit through 6 months, and we're seeing similar results 6 months or a year out. Patients are able to maintain these benefits, particularly if, like I mentioned earlier, they're able to integrate therapy and other effective treatments, other traditional treatments after this. All right, we're going to get started here. You're going to feel a little pinch on 3. 1, 2, 3, pinch. Good job. And you can see that needle coming down on the right side of the screen, and that's coming right up next to that ganglion, which is right there. Good job, Julie. You're going to feel a little pressure, aspirate there, and put a little saline in. Good. Swap. Aspirate.
Good.
And you're going to feel pressure as that ropivacaine goes in. That pressure is going to last about 20 seconds or so. You're doing great.
2. That's halfway.
Keep going. Aspirate one more time. Continue. It's looking great. How you doing, Julie?
Great.
Awesome.
Okay, that's 6.
So that needle's out. Flush.
Flushing.
We're going to pause momentarily and move on to the second and final spot. We do 2 spots along this cervical chain because it's a more effective block. If by targeting the upper cervical ganglion at C4 as well as the stellate ganglion at C6, studies show that the benefit increases and maintains longer. All right, here's that second one. 1, 2, 3, pinch. Feel a little pop or pressure right there. Good. And a little bit right there. Good job. Aspirate there.
Good.
Over the ceiling. Swap. How you doing there, Julie?
Great. No problem.
Okay. Go ahead, aspirate and ropey.
Yep. Good.
Pause. Aspirate one more time.
Good.
Go ahead. Good.
That's halfway.
Pause. Aspirate one last time. And Julie, we're going to be done in about 3 seconds. 1,
That's
2,
it.
3. That's it. Medicine's in. We're all
Good
done.
job.
Needles out.
That's it.
You did great. How do you feel? You feel okay?
I feel great.
Awesome.
That didn't hurt at all.
It's going to wipe off some of the
Uncomfortable, yes.
excess.
But it didn't hurt.
Nice. That's what we like to hear.
Good morning, everyone. Okay, it's been 1 week since my treatment, and I have to tell you that I feel pretty amazing. I feel so much lighter, and I don't know. It's hard to describe, but definitely lighter. I tend to hold a lot of guilt about parenting, guilt about my son, his mental health struggles. And I'm not feeling as heavy anymore. So that alone has been amazing. I'm sleeping amazing. I get very sound sleep. I'm not having a lot of crazy dreams anymore. I wake up refreshed and ready for the day. It's been life-changing. I can't say enough about it. If you are thinking about doing this procedure, and I'm telling you this from my heart, just do it. Call me, schedule it. Let's get you in. Let's talk about it. I want everyone that I know to do this because it's such an amazing feeling. I will try to check back in at a month and let you know how I'm doing then, but hopefully I will have a lot of continued benefit as the weeks progress. Thanks.